Attention pelvic floor therapists, if you do intravaginal work and you would like to get a stronger pelvic floor muscle contraction, please check out the rest of this video because I've got a tidbit for you.
Hi, I'm Lynn Schulte, pelvic health physical therapist, curriculum developer, and principal instructor at the Institute for Birth Healing.
So in this video, I'd like to talk to you about the external anal sphincter muscle. So the EAS, which is right here, is the muscle that closes up that anus. And I have found that when I assess and release the knots in the EAS, that I definitely get a stronger pelvic floor muscle contraction. So I'm going to explain to you how I assess this. And what you're going to do is your index finger is going to be on inside vaginally. And then the next thing you want to do is you want to warn your clients first before you just go put your thumb on their anus. It can be a little discerning for some people and they don't like it and they may actually say no. So I always ask my clients and say, is it okay if I check out your external anal sphincter muscle by putting my thumb on the outside of your anus? And I let them respond before I do. And so you have to work your thumb backwards on some people to get through the tissue, the glute tissue, in order to get your finger on that EAS. You can have your clients kind of separate their glute cheeks with their hands if they can to help you get in. Or sometimes I just kind of push my thumb in, walk it in, and then push to the other side and kind of walk, work my way side to side to get back to this EAS. When the other thing you need to be aware of is that when you're assessing this EAS, it does not sit perpendicularly, that the angle of the EAS is actually at a 45-degree angle here. So when your thumb, if your finger is internally, your thumb actually shouldn't be straight up and down because it's going to miss the lower part of the sacrum or the EAS. So you want to make sure that your thumb is more at that 45-degree angle. Then I just keep my thumb in this position and I just go around the clock using my thumb, and I use the pad to assess the top half, and then I just use my fingernail bed to assess the lower half. And I'm looking for thickness in that tissue. I'm looking for tension in that tissue. And once you assess that, you can learn how to release those muscles. And when you do, it definitely improves the pelvic floor muscle tension. This is also really important if your clients are dealing with hemorrhoids or fissures. You have to address this muscle to help speed up their recovery. Because what I find is there's usually multiple knots in this muscle, especially postpartum. And the knots are usually opposite where the fissure is. So if this muscle is supposed to open up evenly every time they have a bowel movement, if there is a restriction, let's say there's a restriction right in here, then that muscle, that part can't open. So this part has to open up even more. And that's what creates the fissures. The increased tension in that circular muscle could also be contributing to some hemorrhoidal activity in the area. So if any of my clients are ever dealing with hemorrhoids or definitely fissures, I'm going to be checking out this EAS, and I just make it a part of my intravaginal protocol when I'm working with postpartum clients. So please check this muscle out and see if you find knots in this muscle, and learning how to release them will definitely give you a better, stronger pelvic floor muscle contraction. Okay, so go ahead and give that a try. If you'd like to learn more about other assessments that you should be doing to get a stronger pelvic floor muscle contraction, please download my 6 key assessments to a stronger pelvic floor muscle contraction PDF. The link is in the description of this video below. Check it out.